Hi, my name is Rob Nassari. I'm with ACO Health Solutions. This is my second video that relates to our newly enhanced GPRO audit solution. We have used our GPRO audit solution successfully with over 21 ACOs in the last 2 years of the GPRO audit process. This year's tool has been enhanced for improved performance reporting and audit reporting through the process. In this demonstration, I'm going to provide you with insight to how the system is used to monitor and track progress and to report on your benchmarks and your practice and physician level. The initial view that's shown in this screen right here has our IPA level segregation of data that shows us patient sample set from an IPA view of Central, Eastern, and the percentage divided into the ACO. If you had practice, it would show practice level views versus the higher level, which is IPA. The other tab within our dashboard is productivity. It shows the amount of audit records that are completed on the top graph all the way up to where you have on our test system 3229 number of patient records that are complete. This graph below shows the amount of records performed and completed by day, and it will allow your administrator or even your auditors to track how you're progressing through the audit process. This graph shows the amount of records by bucket, and it shows and it corresponds with the 5 buckets that we have to the left. Pending, of course, is our bucket that we learned in the last audit, where all records are started within the audit process, and then they follow through within the sequence once you complete the audit, and then it's validated within CMS. Module progress is a report that allows us, our customers, to monitor and track how each of the metrics are performing, number of skips that are occurring within each of the records, and of course which ones are not qualified. If you remember, CMS has this report on the Quality Net system, but they only have it available once you've completed up to 411 sequence audit records. So we maintain this report. We provide insight to how you're progressing, which areas are being skipped, and some of the areas that you need to focus in on. I'm not going to go into the workflow of the GPRO audit. That's shown on the video before, of course, and it's right along here, and it shows the custom workflows and how we perform each of the audit process. Instead, I'm going to walk down and click on the audit performance reporting area of the system. This module allows your ACO to quickly understand how your audit is performing and how your ACO is performing within each of the 22 metrics. Down the left side here is all the metrics, and of course, since we have the IPA view, we can quickly pull over the IPA view into a column set and be able to show how Central, Eastern, Scotland, the various organizational views that we have within your ACOs, or at least in our test system. Move this into the drop field area, and it of course is eliminated from view. So the next view that you would have if you drop down, let's say fall screening, or let's do high blood pressure, DM13, you'll see the next view is a practice level, and then the aggregation below is a physician and patient. And it shows basically all the patients that are shown and been reported on, and how they performed against the benchmark. This is the 2014 benchmark, and of course the quality points that are associated with that. This Power Pivot tool is extremely powerful. You can basically set up any views and provide any level of information necessary. You can do custom filters that shows a particular patient or particular physician that's listed within your ACO, and be able to utilize these drop downs or move this information in and out so that it's shown and represented on the screen. Any of the tables that are shown within our system that has an Excel icon can be exported into Excel and to be shown in a different way, so that you can pass the information around or present it in a different format if you so care to do so. Also available under the performance is the detailed performance data, the audit data that was performed within the audit. So once you report any of the metrics, this information is auto-calculated and showed in this view. And again, you can obviously download this in Excel, and since IVD has two different metrics, we show the two different metrics within these tabs, and then you can be able to monitor and move around through this view and see who was confirmed, who was not confirmed, and how they perform. The value of this is highly powerful. You can perform, you can follow up and do performance reporting and ensure that your physicians and practices are following your process improvement processes. I welcome any questions that you might have, and I look forward to meeting you or talking to you and your team regarding the features and functionalities within our system. You can reach me at www.acohealthsolutions.com, and thank you again for your time.